Good afternoon, everybody. I thank the scientific committee for giving me this opportunity to talk about the pros of cornea. First, we'll see some funny things about cornea. Actually, I don't have any financial interest and only academic interest in this presentation. We just have to open the door for others to go in and do anything which is necessary for the person's eye. And enucleation is done by others, and we take the credit for the transplantation later. The only specialty which has got a bank and without any floating rate of interest or any change in the FDA policy changes is the cornea. And if we are not there, then neither patient nor the other corneals or the other surgeons can see. And we have to only worry about 3 things, or probably 4, about keratitis, opacity, and anything that doesn't fit the above 2, we term it as dystrophy or degeneration. Initially, when I joined the cornea in 1995, we need to do only one thing. We need to learn the suturing, and later on, we are now moving towards the sutureless surgery with the advent of different types of keratoplasty. Initially, a torch and a loop can diagnose the diseases of the cornea, and now we have marched from the Stone Age to keratometry, topography, pachymetry, op scan, anterior segment OCT, and whatnot. Femtosecond, corneal collagen cross-linking, and intacs. For those who needs and who wants to face the challenges, there is a femtosecond laser and C3R and intacs also. So we have marched from the Stone Age to the Chip Age. After escaping from mathematics and joining medicine, here the evaluations are there, but probably the evaluation and planning is done by the humans and execution mostly by machines. And if vision doesn't improve after surgery, either the posterior segment or the astigmatism, we can term that as the reasons. And the panacea, keratoplasty, which was just penetrating keratoplasty initially, has now moved on to DALC, DSEC, and it depends on our learning skills. We can just master anything and become a keratoplastic surgeon. And why cornea is the best? It has got the best visual prognosis and results following any ophthalmic surgery down the era. And with contact lens practice, we can have a regular financial supplement. We can have any type of contact lens depending on the patient, either bifocal or multifocal or toric. And then refractive surgery is the most paid ophthalmology specialty. And we deal with the most successful human organ transplants. So, psychologically also we are satisfying. And the present refractive surgeries can take off the higher order aberrations, aiming at the best visual outcome. And we deal with the most common cause of painful vision loss, namely the corneal ulcer. And the flow of the patients can be either upper or lower socioeconomic, and it's constantly increasing. And the options to specialize in surgical or non-surgical anterior segment is also equally satisfying when we specialize in cornea. And finally, during recession period, and if we do not want to practice our tailoring skills learned from keratoplasty and pottery skills gained from the molding the cornea during the contact lens practice, multifaceted and will stand in good stead later. Thank you.
Thank you, Dr. Mohan.